I would like to call the May 2024 meeting of the Indiana EMS Commission to start.
Matt Shady,
Present.
Darren Hoggett,
Present.
Lee Turbin,
Present.
Jerry Harder,
Here.
John Zartman.
Don't see him online.
Dr. Sarah Brown.
Here.
Matthew McCullough.
Here.
Andrew Bowman.
Here.
Dr. Jim Nauset.
Here. Present.
You have quorum.
Thank you very much. If everyone please stand for the pledge of allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The adoption of the minutes. Those are the motion.
Have just one minor correction. Page 3, under IDMSA, point on the last sentence. This November, they are animating a larger turnout this year. I think we can anticipating unless.
Yeah.
Unless, Bolt is thinking they can come back.
You never know.
Minor detail. Otherwise, I move to.
Motion to approve. Any further discussion? You have members online, so we'll have to take any roll call.
Matt Shady,
Approve.
Darren Hoggett,
Aye.
Lee Turbin,
Aye.
Jerry Harder,
Aye.
John Zart, no, he's not on. Dr. Sarah Brown,
Aye.
Matthew McCullough,
Aye.
Andrew Bowman,
Aye.
Mary Ann Dudley,
Aye.
Dr. Jim Nauset,
Aye.
Lori Maley, and Director Thacker.
Aye. We could obviously acknowledge everyone, lots of historic awards, cardiac arrest saves. We did have 2 Emeritus awards that were given for Billy Joe Aubrey and Robin Hope. Both of them well deserved Robin posthumous.
Information only. Next up, reports, Indiana Department of Health.
They've been in contact and we have regular meetings with them. We have done something new with our close partnership as an agency. Then we meet with them every other month and kind of touch base on our major projects. We do have several things going on. I think probably the big thing, the State Trauma Care Commission still continues to advance and grow, and they have defined subcommittees, and those subcommittees, Dr. Gazel is chairperson of one, co-chairperson, and then Andrew Bowman sits on one, I sit on one. And so there's a lot of good work being done there. And so I'd ask people may want to look at that and follow the State Trauma Care Commission.
Legislative update, Director Kennedy.
For legislative updates, it's not legislative session, although we are getting towards the part where legislators are thinking about next January and what bills, because the drafting process takes a while. And so people will be submitting And so that will begin to pick up in earnest. As a follow-up to this legislative session, working on is the Medal of Valor that was created, which will be issued by the governor. And that is something that will be processed, submissions to IDHS, and then IDHS will have parameters, and we'll work with the governor's office then on whether the individual qualifies. So right now, I would just say it's in work, and then once they have those parameters, we certainly will share, because it applies to all responders, which certainly includes EMS. The other big one we have is House Enrolled Act 1302, the county EMS survey. County commissioners must complete a survey by July 15th. We have to complete a report as an agency by August 15th. So we have a 1-month turnaround. And then what is the process? We're still having meetings on that, and we're still taking ideas for information that needs to be collected. I know the goal that as soon as possible, but no less than 30 days before it's due. And we sign up with association that represents county commissioners to kind of talk through any concerns they have. So the idea is to gain that information. The we need you. The reason we need you is, frankly, some counties may be versed, they may be able to respond, but a lot of counties are going to have to talk to their EMS. And so I would be talking with your county officials, come up with a plan for how they want to answer that survey. And we anticipate having a website devoted to that. Our public affairs will develop, and it may even have like a completion or a status map, kind of like the highway status, where maybe if we know you're working on it, then you're in yellow, and then once you have submitted, then you're in green. And so it's just something that close to the deadline in July. And so watch for that information. We're in a brief EMS because the task is on the commissioners, but they cannot do a survey on EMS unless they fully understand the EMS that's going on in their county. So that is our ask. There's some of the information on there that was the name each EMS provider. They have to list funding sources, the level of care for each provider, average response time for each EMS provider in the county, and then factors that influence or delay response time. And then number 7 is the additional information that we're gathering, some additional questions that fully understand. And I think the intent of this was to report back to legislature. They have the option of doing a summer study session. And our hope is maybe they look at a more unified approach for counties in terms of what the expectations are for EMS. And I just want people to be prepared. We want people to be prepared and make sure we get full representation of EMS.
Any questions for Director King? Next up, EMS for Children, Margo Cannell.
Thank you. I wanted to take this opportunity to update everyone on how we're progressing with the pre-hospital pediatric readiness project. The PPRP is what it's referred to across the nation, as well as EMSD Day and Educational Opportunity. But I'd like for everyone to either get on your computer or a phone and type in emspedsready.org. You could do that right now. Don't worry, you're not taking the assessment, but I would like for you to click on Start the Assessment, go to Indiana, and then go to your county that you reside in. And if you could send the contact person that you know a text message that says, hey, this is available, please complete. We are looking at 682 EMS agencies to take the assessment. This is all of our public 911 responding agencies. So it's emspedsready.org. Also on that site, if you go to the bottom, you will see the national response rate. So they decided, they meaning the steering committee, that they would make this public knowledge to see how all EMSD programs across the country are doing. So if you look at Indiana, we're currently sitting at 9%. The national response rate is at 11%, so we're just a little bit behind. We have been surveying our EMS agencies over the years. 2017, we did a sample of our EMS agencies. In 19, 20, 21, and 22, we did all of our responding agencies based on 2 performance measures. If you have a pre-hospital pediatric emergency care coordinator, and what that looks like for your agency, and then how do you verify the proper use of pediatric specific equipment and what that looks like for your agency. And so in 19, 21, 22, and 23, we did meet that 80% response rate requirement for funding for HRSA dollars. And then last year we were 20 short. Now this year it is a larger assessment. We're going to do away with the annual survey. And when you take the assessment, you do get a score. It's a weighted score of 0 to 100 on how prepared you are for pediatrics within your EMS agency. Next slide, please. So when you look at this county map, if you look at the gray, those are our agencies that haven't yet responded. We did just launch May 1st. We are a little bit behind schedule with our response rate. We really should be at 10%. We have sent out 2 email reminders letting agencies know that it's live, but it only goes to 1 contact. So that's kind of a disadvantage. So that's why I'm taking this opportunity to share with you that you can just send a text message, send an email, let them know it's available, because ideally we want all of our EMS agencies in the state to take it so that we can develop programming. Over the years, we have instituted a pre-hospital pediatric emergency care coordinator on the EMS agency's renewal, or if you become one in our state. And then also we've developed a PEC roles and responsibilities document for the pre-hospital care. So what does that look like individually at your agency? But this is a huge undertaking. We have until the end of July. But ideally, if we could get it done in the month of May, because we do everything big in Indiana in the month of May, then we can go ahead and move on to other things. EMS district managers have been instrumental and huge helping us make sure that we reach all of these individuals. But again, if we could just reach out, 59 out of 682, so 8.7%. So just a little under the 10% that we should have, that we've seen in previous survey years. So again, where it's located, emspedsready.org, bookmark it, reach out if you're the medical director or if you're at that EMS agency, let them know that it is available. There will be 3 more future reminders, and then I have to start calling every single agency to ask them to take. So if we could do it on the front end, they would avoid those email reminders and they would avoid those phone calls. It does take about 30 minutes to complete. You will receive a gap report. So it'll show your strengths and then areas of improvement, as well as a toolkit. So how do you get there? How do you make those improvements when it comes to pediatric readiness for your agency? It is confidential. No one's going to know what you scored individually unless you share that data. We will eventually, I say eventually, but in the winter, we will share state level results as well as the nation. So how does Indiana compare when it comes to pediatric readiness? And then again, open until end of July. But if we could complete early, I would greatly appreciate it. And then lastly, as EMS week is quickly approaching now that we are in the month of May, there is a webinar that's available on EMSD Day, which is the Wednesday, it's May 22nd, from 5 to 6:30 for the pre-hospital pediatric airway management, the past, present, and future. 90 minutes of continuing education. It is on our social media accounts and will be distributed in our newsletter.
Thank you. Any questions for Margo? Okay, one thing I would like to add, a little bit different from surveys in the past, but when you complete the survey, you actually get some data back on your own ranking on how well you did, how you rank against everyone else who's taken the survey, and how you rank against locations and how you marked it. So even just initially at the end of the survey, you come away with that with a multi-page plan on the things you focus on as a provider. So not only, it takes a little while to do the survey. It's a pretty solid one, but you get something to take away from it that gives you something that you can work on and at least shows you where you are compared to everyone else. So I found it to actually be an edifying experience to go through it and do it this year just because of the output that came from doing it. So I would encourage everyone to do it as quickly as possible.
Yes, I would really like 100% response rate to show that we have that in our state. And it can be done. we've done remarkably well over the years when it comes to this assessment. It's just a little bit larger to capture all these data elements on where you should be, based on the joint policy statement from 2020.
Thank you.
Thanks.
Indiana Fire Chiefs Association, I believe Director Kenny is there to cover.
Jared Sites had gotten a hold of me. He's actually doing EMS commission work today, and IDHS, he is proctoring an EMT exam as a state representative. So we appreciate him doing that. The main thing they had is reminder of their conference will be in Noblesville this fall, and it will begin on October 2nd, go through the 3rd, 4th, and 5th. And so watch for further information on that as we get closer to it.
Indiana EMS Association.
Morning, I have one thing and then I will turn it over to Tom to finish. There's been a lot of questions already about the Governor's Cup this year, the competition that we had. So I wanted to clarify that we've actually expanded how we're gonna do that this year. First of all, Doug Randall, Jeff Quinn, and Mitch Masson, who is with Parkview, are gonna be the ones who are gonna be spearheading and running this competition. We had an overwhelming request last year to add a critical care component to that with paramedic and nurse. So this year we've added it to, we're gonna have EMT, paramedic, paramedic nurse. These scenarios are written kind of between Doug Randall and Dr. Yazel. They go through and they come up with scenarios, obviously be 2 different ones, one for the regionals and one for the finals. The regionals this year are gonna be 5 of those done ahead of time. We're gonna work in conjunction with Ivy Tech. So obviously, if you know how it's set up, 2 of the IDHS regions equal 1 IMSA region. So each IMSA region will actually have their own regional competition. And then the winners from each of those competitions will come to the conference in November on the Wednesday, and they'll compete for the finals. We used the new sim lab last year. The mobile RV was phenomenally, was just a phenomenal tool, and people just love that. So we're gonna be using that again this year. To make everybody happy, so it's all across the board, the judges that we use, because we asked the question where we find them, they are not from anywhere in the state of Indiana, with the exception of the doctor. The other evaluators are all, we bring in from outside states, so they know nobody. There's no any prejudice at all, because they have no idea who these people are. But those competitions will be announced soon. Again, they'll be held at Ivy Tech. I would encourage you to start talking to your staff now. The winners of the competition this year, again, are gonna be sponsored and invited to participate from Indiana in the GEMS games at the IC. So we're working to expand that, kind of really bring that back to where it used to be. And we would love to have you guys start talking to your employees now, talk to your staff, paid volunteer, whoever, get them excited about this. Let them start practicing, working together, getting used to this together. I think it's going to be a great competition this year. I think we had 9 teams last year, and it was the first time we brought it back, really, since we had the momentum before COVID took over. So I think next year, this year actually, I look forward to a lot more teams being interested. We heard a lot of interest last year. It just really got traction too late to get rid of where we wanted it last year. I'll turn it over to Tom. If you have any questions, please get a hold of me or Doug Randall, and we'll point you in the right direction.
Thank you, Bob. Good morning. Thank you for taking the time here. Couple notes coming up. We have May is a pretty busy month for us. We have the Running with Shears tomorrow down here in Indianapolis. It's on the State Museum lawn, which is 650 West Washington. It's going to run through White River State Park. You can still register. In fact, we've had several register today and yesterday. Our numbers are upticking. We're at about 203, which is really good since
We didn't really have we didn't know we were gonna do this until about a month ago. So kudos to Jeremy for really pushing the envelope on that one. You can, like I said, you can register till 9 a.m. tomorrow at our website, which is indianaems.net, or you can just go to Google search Run with Shears Indianapolis, and it'll take you to Racemaker's website, and you can register there. If you are registered, you can pick up your packets starting at 0800 tomorrow. The fun run for kids will actually start at 0900. Opening ceremonies will be at 0915, and the race starts at 9:30. Jeremy's asking if anybody is liking to volunteer or you have any students that need some volunteer hours, please reach out to him. He'll be here all day. He's sitting up in the back room, and we have our meeting after this. He can tell you where you can use you the best. Other things that are going on, like I said, May is a pretty busy month for us. So Golden Sirens Awards dinner comes up next Saturday, 5/18 at Primo Banquet Hall here in Indianapolis. We still have tickets available, so if you're thinking about something to do, we still can do tickets up to tonight. We got to close that up. We got to get our food order correct. Dinner for the Golden Siren starts at 6. Doors will open at 5 o'clock. If you've never been, it's I know I'm biased when I say this, but it's a very good event. We have a very good time. It's nice to acknowledge some of the Golden Siren award winnees and actually see everybody else that comes back. So please attend if you can. Last on my list is our conference. Our conference is November 21st and 22nd. We will have a pre-con on November 20th. That's going to be in French Lick, Indiana again. Currently, we have call for abstracts. I believe we're at about 30 presentations right now. So a little lower than I'd like, but I know that I've seen a couple that have come through, or I've been told a couple come through from our commission. So I appreciate the commissioners that have done that. Registration is open. It is early bird registration. So if you want, please get in there soon. I don't believe our hotel link is up as of yet. That will probably be in the next month to get your hotel squared away. I will tell you, last year, our hotel for French Lick did sell out of our block. We had to increase it twice, I think. So we really need, the more that we can get them registered early, the better it's going to be. It's less hassle on Bob and myself to keep making phone calls to get those things taken care of. If there's anything I can do, please reach out to me. I can give you my contact information, but I hope to see you guys at all our events. Thank you all. Yes, sir.
When's the deadline for abstract?
I believe it's June 15th, but more than likely we'll do the extension like normal. We'll do a 2 weeks. We'll give up a deadline and a soft extension for 2 weeks after that. So yeah, we want to get them in soon because then we do the double blind study where EMS, if you link for EMS, it goes to nursing. So they review all the EMS abstracts, the nursing side does, and then vice versa. EMS side will review all the nursing side, and then we'll come back. And so it does take a little bit of time, but we want the best bang for your buck in terms of presenters. So we've heard nothing but great things about our presenters. I appreciate everybody who has presented over the years. Last year, there was a lot of accolades on the presentations, how they were done, the professionalism of those presenters that were in there, the vast majority and differences that they had. So very hopeful we get the same amount and the same quality of presenters this year.
I'm just encouraging the commissioner to have education as part of your role, whether you consider submitting an abstract. To get your favorite topic there.
Yes, please do. Please do. We'd love to see you all. Thank you, guys.
Thank you. Education Oversight Committee. We got John, if you're online for Education Oversight Committee.
I am. Can you hear me?
Yes.
So we did meet by Zoom, and we talked with all of the individuals that will be composing scenarios for the new advanced EMT exam. We have a target date to meet at MAID on June 21st at 10 a.m. To go over those scenarios and finalize those that are submitted, and then they will go to the two medical directors to review before implementation. So we are still well in line with the implementation date. I can't say for sure that it'll happen on July 1st, but we tend to have that done here in the next couple of months. So we are in the final phase of finalizing the scenarios.
Any questions for John?
I would just add, I think the staff has considered if there are any advanced EMT classes, first of all, there aren't a large number of them, but if there are any that end before we get the full new one put out, then we will come up with something to accommodate, so that way we can have a process for them.
All Integrated Health Committee. Director Kennedy.
Thank you. We met on April 12th here at Maine. And we did not have any programs asked for approval. That's the first time I remember since we started way back in March of 2020. So we actually do not have an action item for you guys to do any approvals. We did get work done though. We did go ahead and fill that new position, education advocacy, with AARP, Amber Marr. And she was able to participate virtually, being very active out the gate. We continue to talk about NIH conference offerings. We have entered agreement with the EMS Association to be a partial sponsor of an NIH pre-conference to be held at the EMS Association conference. And that was at the request of the membership, said they wanted something where they could get together in a conference setting and, continue to gain education and have discourse. We did have a joint meeting with the I4A, as I learned, because I kept butchering IAAAA. And they're like, you just say I4A, and I'm like, you told me that for the meeting, thank you. But the I4A is Indiana Association of Area Agencies on Aging. And also IAAAs, which are the actual regional offices, and they run the outreach, helping these senior community, and they have a variety of things they can help with, financial, they have assistance, different things like that. And so their idea of connecting with us are, one, they are a resource. When we have an MIH provider, they may be able to help fill a need that is needed. But on the other hand, sometimes they may have a need to reach the population, which they don't have a system. So we hope that this is the beginning of a good partnership between our MIH providers and the I4A. The next meeting will be June 14th at 10 a.m. out here at Maine.
Any questions for Director Kennedy? Hearing none, we'll move on to new business. HEA.
Morning, Jessica Goodell, IDHS General Counsel. I'm here just to provide a quick update on administrative reviews and how any matter that is appealed to this body will be handled come July 1. There was some new legislation, House Enrolled Act 1003, that essentially says come July 1, any new case that's filed that's assigned and given to OALP, the Office of Administrative Law Proceedings, to assign an administrative law judge. They matters now. The current process and for currently open cases was the cases were filed. We would assign them to OALP to assign an ALJ. The ALJ, if there was a substantive order that was issued, would then issue a non-final order that would come back to this body for your review to approve, modify, or to send back to the ALJ. That process has now changed, and that the OALP ALJ will now be issuing that final order. There's no later review process in this framework anymore. There is a carve out where this body could decide to be the ALJ in cases themselves, conduct the administrative hearing, issue the findings of facts and conclusions of laws. However, we strongly recommend against this. Most boards and commissions aren't set up to conduct these type of hearings. So it's our recommendation to continue forwarding our cases to a OALP ALJ to conduct these hearings. And we will continue notifying the commission of all matters that are filed. They'll be placed on your agenda for awareness of new matters that are filed, and giving a copy of all final orders that are issued by an OALP, ALJ to this body for your consideration. If you may want to modify a rule based on the outcome of a proceeding, or you might not like how they're ruling, and you might say, you know what, this is something we do want to take on later on. And so you could always change your mind and go back to that process and decide you want to conduct these hearings. However, we would recommend staying with the current process, assigning these cases to ALJ hearing officer, and happy to answer any questions about this legislation or any concerns you might have.
One, and I didn't understand in reading it. Is there still an appeal? I understand, like, you know, we have one today, a non-final order, we're gonna make a final order. And then currently they can still appeal that final. So if the ALJ has ultimate authority, issues a final, can that still be appealed? Which level does it go to?
So after the process would be, if we're continuing to send these cases to the Office of Administrative Law Proceedings, is after the ALJ issues their order, there would be judicial review rights, and either party could appeal to a trial court essentially for a hearing on the matter. There's no action needed if we're keeping it the same. But if we didn't want to modify processes, then we need to take some action and have some legwork.
Any discussion?
Thank you all.
What is the funding opportunity?
This will be the third cycle of it. We were fortunate to receive for this 2-year biennial budget. We have 500,000 per year. We administered the fiscal year 24 began last July and is ending coming up here in June 30th. Fiscal year 25 begins July 1st. And so we want to be ahead of the curve for once. Thank you, Emily, jumping on that. And so we have a notice of funding opportunity that we would like to approve so we can start accepting grant applications. Again, the basic requirements has to be an EMS provider organization, has to be a city, town, or township operated provider, and that's per Indiana code. That's the biggest pushback. I'll advise the commission that I hear that hospitals and county levels are not included. However, I don't think you could approve a no vote that changes that because that's state law. So and what I tell people when they have concerns is talk to a legislator and see if you can get that changed. And then it does have to be an approved MIH program to be eligible for funding. Our priority areas would stay the same: new programs or expansion of existing programs, programs to demonstrate community need, cross-disciplinary cooperation, and programs that propose matching funds. And we use a matrix based on that to determine how we make the funding recommendations. It is described in there, but the way this works, the applications come through, staff will review, we will rank them, the EMS commission by the final recipients after we present the request. And then the commission would then decide on that approval. Our target, we're targeting around $50,000 target for organizations, which would reach about 10 of them. We will set the max of 75,000. Last time that was a challenge because we had a lot of people well above 75,000. And we did not approve anything above our stated max for that reason. So we want to keep them around 50,000. That would be the process that would go. There are the dates. Once you approve it, PIO of our office helps with sharing this. We anticipate we can get it out by June 1st. So we'll probably have well over 30 days notice. We're announcing today it's coming down. We've been telling MIH groups that it's going to drop, so I don't think anyone will be surprised. Period of performance will be September 1st through June 30th of next year, September of this year into June of next year. We anticipate the approvals after July meeting and then contracting in August. And then probably by the time payment comes through, organizations should expect payment around January of 2025. I will clarify if there are interested organizations listening, payment is only done when you complete the proposal that you had. Indiana does not pre-fund things. So like if you're looking to buy a monitor for your program, you would have to purchase the monitor and then you submit for reimbursement from us through the grant. So the full NOPO is in your packet. That is the correct one. Staff is asking for approval of the notice of funding opportunity for fiscal year 2025.
Motion to approve.
Second. Approve the second. Discussion. Roll call.
Matt Shady,
Aye.
Darren Hoggett,
Aye.
Lee Turbin,
Aye.
Oh, he's on, he's unmuted.
Dr. Sarah Brown. Aye. Matthew McCullough.
Aye.
Andrew Bowman,
Aye.
Mary Ann Dudley. Aye. Dr. Jim Nassett,
Aye.
Lori Bailey.
Aye.
And Director Joel Packer.
John said yes. He just
John said
texted
yes in
me.
the comments.
Moving on to EMT curriculum, DOT training.
This is a follow-up. So when I do travel with national organizations, I represent Indiana, but I also, sometimes we're advising them, so it affects policy that comes back to Indiana. But a lot of times I take ideas that I'm getting from there and bring back here that we can implement. And this is an example of one I attended in March, National EMS Leadership Summit at NHTSA. And that's National Highway Traffic Safety Administration that has an office of EMS. And with the office of EMS up there, and traditionally, EMS at the national level has been at NHTSA, although National Fire Administration now has an EMS division. And of course, you have Medicare under Health and Human Services. The reason you don't have a regular national office over everything is because EMS is considered a state right. And so the state has the ultimate authority, and these are supporting organizations. So NHTSA came out because initially, frankly, they were concerned about traffic accidents in the 70s. And that's where we landed. That's where the curriculum had come from initially. The current office of EMS is focused on clinician care out of hospital, but usually as it intersects with the highway traffic program. And so when they were out there, they tried to get feedback. And one of the key things they also look at is their National Roadway Safety Strategy, NRSS, to have a safe approach for responders. And the idea is to prevent people, response individuals from getting hit when they are attempting to help on a highway incident. And so the goal would be to train up. And one of the things they look at is with that safe approach is having robust traffic incident management practices. And that involves some training and education, but make sure that your DOT and your fire and your EMS and your law enforcement, that we're all on the same page as we respond to incidents. Here's an example of that. 911 was dispatched EMS to 1.5 million crashes. And there were 169,000 seriously injured individuals with 42,000. But we are exposed quite a bit when we're out there handling these traffic incidents. And so the things besides protecting responders is safe movement of traffic. So you get responders like an ambulance in, but also get it out of a traffic backup. And so it's kind of important to have all of this system-wide integration. Some of the post-crash care they have is improving EMS personnel on-scene safety, improve responder and motorist safety. So sometimes we can be watching out for the bystanders that have stopped to help, improve availability of quality of national EMS data, and then improve the delivery of EMS throughout the nation. The big one that I'm bringing up to discuss today is the TIM, the Traffic Incident Management Program. And the TIM is trying to take those concepts and introduce it to people so that responders understand optimally how a highway response should work with all the facilitation. So the course has TIM fundamentals, it covers terminology, notification, how to do a scene size of, safe vehicle positioning when you're parking on a scene, scene safety, command responsibilities, traffic management, special circumstances, and then clearance and termination. When I discussed this with them, one of their goals was to have better EMS involvement, and they're trying to track the number of individuals that are in EMS that are taking these programs. Fire service has been pretty good with it. EMS is doing well, but in pockets, and there are other programs that really facilitate TIM and other items. The question I took to our staff and our recommendation would be, there is a 4-hour online course that can be completed. It is verifiable, it produces a certificate, and it gives that kind of entry level exposure to traffic incident management. Yes, it is 4 hours, but because it's online, it is the feeling of staff and myself that it could be taken with an initial EMT course and added to the curriculum, because it wouldn't add to in-class hours. It's an out-of-course assignment that could be done kind of like we do our ACADIS trainings right now. And so our request today would be to consider, or if you are uncomfortable approving today, then have someone, a group, add that TIM course to the EMS curriculum as a kind of out-of-course homework assignment.
But question, whatever happened in,
That's
time training?
I think Tim is an offshoot of that. I don't know. Jason, do you know that? He's kind of our traffic person more than I.
This, that training still exists. 8 hours, 8 hour training. There's minimal number of instructors, and this was born from this, and then this effort initiative, and now this 4-hour course is a way of addressing kind of meet the middle sort of thing, where you get basics, you get the preliminary information, and get the fundamentals. You will a way to basically get that out to more people.
So it's just a short version of the one that.
Yeah,
through the offer.
Yeah.
And Jason reminded me, that is, they did cover that. Thank you, Jason. I had spaced that part, and that is correct. They said, I just didn't recognize inline. They said the existing programs, they acknowledge they don't have enough instructors, they've not trained enough. Now, some states go to that next level, you know, and they amp up their instructors, but they created this as a more user-friendly model to get the introductory material.
Is this just application for adding this to current EMS curriculum going forward, or are we looking at adding this as a requirement for current certified professionals?
I'm always cautious on the number of hours that people have to get, because we like the local determination of audit review. And so I encourage it, we will accept it as continuing education, but our request is added to initial education at the EMT level, possibly EMR level. I don't know that I would do paramedic, since you have to be an EMT before you become an advanced EMT or a paramedic.
I suggest we have the Education and Oversight Committee take a look at it to see if there is any impacts that we're not aware of that added into the initial curriculum.
Do that.
Is that a motion?
It is.
Okay. Do we have a second? Thank you, Dr. Lawson. We'll call a vote on this, please.
Matt Shady,
Aye.
Darren Hoggett,
Aye.
Lee Turbin,
Aye.
Jerry Harder,
Aye.
John Zarban,
Aye.
Dr. Sarah Brown. Aye. Matthew McCullough,
Aye.
Andrew Bowman.
Aye.
Mary Ann Dudley. Aye. Dr. Jim Nossick,
Aye.
Lori Bailey. Director Joel Thacker.
Aye.
Motion passes. Before we move on, just to add a note that I do support putting that in the EMT curriculum. That's the direction we're going to.
I'll add to it is a very good training. You can tell people working interstates and major highways who have it. Thanks,
Thank you. Moving on to old business, moving on to protocol stuff.
Just real quick reminder, we approved intranasal glucagon a few meetings ago, and then we discussed last time. We had heard, hey, that's cost prohibitive. Can we look at IM versions of this? And we talked about either an auto injector versus a draw up component of it, risk benefits and things like that. Did think possibly, especially in our rural settings, that there may be a role for that. And then we kind of tabled it to, allow some time to think about the implications and the risks and benefits. Really, the only update I have in the interim, a lot of times in these situations, I hear from services, yay or nay, or concerns and things. Haven't really heard much feedback in the interim since the last meeting. So unless there's been other thought, nothing else to say on that right now. So.
I would just add, I think as we reviewed the agenda, we were hoping to have a yay or a nay. We don't care which, but we have organizations that may be doing this and we have organizations that are waiting, not a huge list, but a few.
We're just saying is just to add the other.
Probably, I guess,
Yeah.
you can specify auto injector versus, are we comfortable with all IM or auto injector versus draw? This probably.
Well, we've already approved it in intranasal.
Yeah.
You just need to know if IM is kosher, and if so, what type of IM.
I'd say I'm personally comfortable.
I will say the draw formulations that I've seen at least are pretty, I mean, it's almost like the Narcan mixed, you really can't.
Anyone before we make a motion?
Gonna make a motion that we do auto injectors and say call it,
Do I have a second?
second.
Okay.
Can you clarify for which levels, I mean, if we're making a motion and voting, which levels this is for, and are there any specific training requirements? Or where does that training requirement lie?
We have done in the past, and it's just an option, it's you guys' motion. What we've done in the past, a couple of things we could do in a CADIS training, that is out there. A lot of times what we say is with approval by a medical director, adoption of protocols, training, and oversight. And those are usually the three things we add if we add something to it.
Would be in favor of a standardized training that the state grades and signs off on and says this is the training that you need to do, at least legitimizes that and makes sure that there is some standard training that's being.
So are you comfortable modifying your motion to read with medical director approval, protocols, and state developed solution, state developed program?
Yes.
Are you, your second? Okay. So we have any further discussion?
Just a notice, I'll be abstaining. I have a prior financial relationship with Eli Lilly for possibly some glucagon.
And this is for EMT level.
Can you repeat the official motion?
Yes, repeat.
Repeat the official motion.
I have this correct. The motion is to allow for the IM injection of glucagon by EMTs in either the auto injector or the draw formulation with a provider having a protocol, medical director approval, and completion of the state developed program
And oversight.
and oversight. Do you have any further, John? Hearing nothing, we'll proceed with the vote.
Matt Shady,
Aye.
Darren Hoggett,
Aye.
Lee Turpin,
Aye.
Jerry Harder,
Aye.
John Zartman,
Aye.
Dr. Sarah Brown,
Aye.
Matthew McCullough.
Aye.
And Andrew Bowman, you're abstaining. Mary Ann Dudley. Aye. Dr. Jim Nauset,
Aye.
Lori Bailey. Director Joel Packer.
Aye. For this, so I'll develop a training and I'll share it with the commission. You'll have opportunity to give any feedback or concerns, and then we'll get out there.
Administrative proceedings.
So we have, you have waiver orders listed, nothing really out of the ordinary. On the discipline orders there, I think we did have one revocation that is listed there, and that was appealed, a timely appeal, so that will go through the appeal process. And that was on Troy Laufman. On administrative rulemaking, we have an update from our EMS council.
Hi, everyone. Hillary Egan, DHS Deputy General Counsel. So we have two separate rulemaking going on right now. One is a readoption and one's just regular rulemaking. So I'll start with the Title 836 rule readoption. So if you guys remember back at our meeting, I believe it was in November or December, we decided to readopt the entire Title 836, which was intended to then going forward, everything would just be on the same timeline. So this is just a readoption of what's already existing to make sure that nothing expires or lapses. And so we filed our notice of intent to readopt, and there's now the notice for public comments period is up. This is has been filed with the Indiana Register, and this is also up on the DHS webpage for the public. So the public now has 30 days, which started this past Wednesday on the 8th. They have 30 days if they'd like to submit any comments, any reason that this should not be readopted. I'm not anticipating anything, but you never know. So that will be going on until June 7th. And if any public comments, then I will bring this back to the commission at our next meeting if there's any public comments to consider. But anticipating that we likely won't have any, this will then, I bring it before the board next meeting. And then this would ultimately go to the governor's office for review. So we'll likely see the readoption happen sometime, possibly in the fall, early fall. So that's just to make sure that Title 836 is just stays intact. And then going forward, it's the whole Title 836 is on the same readoption timeline. So we're not having to bring action items before you guys constantly, which can be a bit of a headache. So that is the readoption. And now moving on to, and this is actually something that will need action from a roll call vote from all of you. So we have actual regular rulemaking going on for Title 836, and it's additional language so this has two components: language for the National Criminal History Background Check and AEMT certification. So just to break those down, a National Criminal History Background Check is now required nationwide, and it keeps Indiana just on the same national standard. So anyone seeking an EMT, EMS certification just has to submit to a National Criminal History Background Check. So we had to add that language to Title 836. This is a national requirement. And then the AEMT certification language, this currently is found in emergency rules. And the state decided to sunset all emergency rules. So on October 1st, 2024, all emergency rules that still exist are going to be expiring. And so that's why we had to make this part of Title 836. So there's no lapse in AEMT certification starting on October 1st. And so how this works for this just regular rulemaking. It's a bit of a tedious process, but we have to get approval from OMB, the Office of Management and Budget, and it's pretty thorough. We have to do like a pretty thorough analysis of why of the rulemaking and why this is necessary. And we heard back from them yesterday, so apologies for this short notice on this, but the good news is we got it on the agenda for today so that this isn't being pushed back an additional 2 months, which would be the case if we hadn't heard back. So they got back to us about our the language. The reason that we have to just take a roll call vote today, they made some minor formatting changes to the proposed language that we had submitted to them. So that was nothing substantive. That was just, you know, indenting lines, just switching the formatting a little bit, but nothing substantive. The one thing I would like to bring to your attention, I think this is part of your board materials, the proposed new Title 836 language documents. So it's on section 9 and starting, this is on page 13. So it's 836 IAC 476 subsection E. So subsection E is kind of mid-page. And so this is the language about an active status for certified advanced EMTs. And the reason they just kind of wanted us to just change this language a little bit to make it this, which I think OMB just thought read a little bit clearer. So this is just the language that I would like to point to your attention. And they were just also asking us about this language, what this means. And essentially, this is just making sure that if an advanced EMT is no longer affiliated with a provider organization or a supervising hospital, they will automatically be put on inactive status. And it's the responsibility of the individual to notify DHS within 48 hours of this. Because currently, without this language, sometimes we're being notified to like it should have been, is essentially language it's for, and that's the only substantive change. So if you just want to maybe review that for a moment.
Can you tell us one more time, page number? No.
Oh, sure.
I got lost in all
It
that.
is page 13, middle of the page, subsection E in bold.
Thank you.
Yeah, and so this is just about laying out how an individual would automatically be placed on inactive status if they're no longer affiliated with a hospital or a provider organization.
And staff was consulted on that. The change is not substantive. And a second reminder too, when you adopted the advanced EMT, it was from the draft rule rewrite. So it actually is an improved language even over the emergency rule. So.
Yes, OMB just thought that this, they just wanted it language, it basically just substantively it's the same, but just reading in a way that maybe makes a little more sense to the audience. And so we just need to have an actual official approval letter from OMB to move forward within the next couple of days, but they are okay with this language.
I make a motion to join the two requests together in a single roll call vote for criminal background check adoption and effective emergency certificate.
Second.
Second.
Please do a roll call.
Matt Shady,
Aye.
Darren Hoggett,
Aye.
Lee Turpin,
Aye.
Barry Harder.
Aye.
John Zortman,
Aye.
Dr. Sarah Brown,
Aye.
Matthew McCullough,
Aye.
Andrew Bowman,
Aye.
Mary Ann Dudley,
Aye.
Dr. Jim Nassett,
Aye.
Lori Bailey.
Aye.
And Director Joel Packer.
Aye.
Thanks, everyone. So just anticipating next action items, we'll be having a public hearing. So there'll be a notice of a public hearing that'll be, and then at some point a public hearing will be held. So that's the next action item for that.
Last item we have on administrative proceedings is appeal consideration. This is a holdover to the change I said. It's interesting that today Justin was briefing us on the change, because this is an example. We have a non-final order where the ALJ has made a legal determination, but it can't become final until you approve it. It is on Chris Mitchell. And the reason that it was an appeal that, staff at the department had elected to revoke this individual. He had, in my language, slipped through the cracks, and it was determined that he was on a sex offender database. And he did report it to us and was cleared by prior staff with no full review by staff. And after consulting with him and consulting with legal, we did not feel it was compatible to have an EMT certification at the time. You have a serious misconduct, sexual misconduct violation. So we did a revocation. There was an appeal. He had attempted a PCR, a post-conviction relief, and that was the big claim. This never happened. The PCR was denied during the appeal. And this is the non-final order, basically is affirming the action of the department. So we're asking for approval of the non-final order as a final order, which would then affirm that our decision was the correct.
Pleasure of the commission.
Move to approve.
To approve, second. Have a second. Any discussion? Move forward with a roll call vote, please.
Matt Shady,
Aye.
Darren Hoggett,
Aye.
Lee Turpin.
Aye.
Jerry Harder,
Aye.
John Zarpin,
Yes.
Dr. Sarah Brown,
Aye.
Matthew McCullough,
Aye.
Andrew Bowman.
Aye.
Mary Ann Dudley. Aye. Dr. Jim Nassett,
Aye.
Lori Bailey,
Aye.
and Director Joel Thacker.
Aye. And one clarification regarding that. If a objection's filed, we may need to bring it back to you. If we don't get an objection within the 15-day window, then we'll issue that final order.
Motion passing. Something.
And that advisement is in the final order that they have.
Okay. Anything else under administrative procedures? Hearing nothing, we'll move to staff reports, data registry.
Ken is online. I think Ken Buster.
Good morning. Can you hear me okay?
Yes.
All right. As far as the data registry goes, the most important news is that we have been working on a problem with the ImageTrend server not being able to accept all the volume of data that has been transmitted to the server. I believe that volume of data has increased considerably in the last 2 years because we have nearly doubled the number of fire departments that are submitting and requesting data from the system. Recently, over the last few weeks, I've met with DHS, Information Technology, IoT, ImageTrend to work on this problem of data imports being rejected because the server was at capacity. Yesterday, there was a major upgrade, which we believe will widen the data pathways and improve the server's ability to accept a larger number of imports at the same time. For the time being, I am not able to calculate April's EMS reporting percentage because we know that there's data out there that has not been submitted because of this import problem. On another other news, I'm working on an MIH encounter form for the MIH committee and creating a form that will eventually be able to collect MIH data for use by the agency and others to evaluate MIH needs in the state. Also have provided some some data for Dr. Yeasel's behavioral health study, and I'm actively involved in the providing data and advice to the Indiana Community Risk Reduction Task Force, chaired by Rob Miller over in Code Enforcement. And that's all I have. Are there any questions? Thank you.
None. Operations.
Want to remind all of the providers to make sure that you are getting your permission requests in. If you do not have permissions in ACADIS for your roster, to get those in. We are continuously moving provider organization certifications over to ACADIS. We started that for the April quarter. Doing July right now. So once those are moved over into ACADIS, your district manager will get a hold of you to be able to print certificates and to be able to do your renewal through ACADIS. I'm finishing up the training institution and the supervising hospital in ACADIS. We're not quite ready to do those yet, but we're getting close. Last thing on my list was provider forums, but my guess is that's probably on Craig's list as well. So I will let Craig talk about that because he probably has the slide with all the dates. That's all I have.
Very good. Certifications and compliance, Director Kenny.
Thank you. First of all, just a quick announcement on how to reach us. There are the emails there that you can use. Still recommend people use the consolidated emails because EMS certifications, for instance, for individual certifications, Ashley does an excellent job as primary, but if she's not available, it's a shared mailbox. So other people can see that, including myself. CertForce apps is for primary instructors, training institutions. It is shared by Robin can view it, but Carrie and Zach Westfall both handle that. And then DHS certifications is lesser used, but it is the one shared by the field staff for processing. We do still have the general numbers that you can call in. That has changed to a call tree. It had been a call tree. Then it was answered by front desk staff. Now it's a call tree. Unfortunately, when they set it up, they inadvertently left EMS off. And so we were bounced around. So people are getting, I had someone call me direct and they were frustrated. So the bottom number. All trees. So the 232-6425 or the 234-7322. You call either of those, you get the call tree for the people in the office. And it's more a direct way to reach if you need to reach us. We also do have support tickets that are out there. And support tickets are a great way if you're wanting to know status. I submitted something, I feel like you overlooked it. We are not behind. Ashley does things usually same day, but give her some time. Every now and then we get a person that will submit a primary application. They will leave voicemail for Ashley and submit a ticket wanting to know the status of it all at once. And when you create all those multiple things, it's taking staff time to do that. And so you should submit, wait a little while, and then if you aren't hearing something, then by all means use that support ticket function. So numbers, currently certified 4,800 EMRs, 13,888 EMTs, 745 paramedics, advanced EMTs, 4,795 paramedics, and then 723 primary instructors. Overall, those numbers were slightly up from the prior quarter, and then renewed for the first quarter. EMRs were a little lower, EMTs were higher, advanced EMTs were higher, medics higher, and primary instructors higher.
So I think we have more people on the March 31st and the October 1st deadlines. The elected to renew EMRs are significant, are fairly high. You can see the higher your certification level, the less likely you are to not renew it. And those numbers have been pretty consistent since we've been reporting, since I've been doing news reports after Candace departed. So where are we? We're at 24,956 clinicians as of March 31st. So that's where we've roughly been is between 24,500 and 25,000. So we're pushing 25,000 again, which is nice. January 1st to March 31st, we had 202 audits. 17 audits were incomplete, about 8.4%. And we have issued 2 certification dishonesty orders in that quarter. And of course, the quarters always go on, so we're in a new one now. We also had 50 individuals check yes, that they have been, and I did not update that. So it's fourth quarter, it should be the first quarter of 2024. We did update the numbers. 50 individuals, 24 resolved by being cleared or otherwise. 31 were waiting on additional information. 3 had pending criminal cases that we're tracking, and then 1 is scheduled for a team review. Any questions for myself or Ashley on the certification number?
EMS education and training report, Carrie Lynn.
That's me again. Carrie is attending a training. She did ask which to attend. And she didn't have a lot of updates. The big one was on the advanced EMT. And I have a few education announcements in my report. I would note that this is a very busy practical season. I think all the state reps, we are working to try to come up with stabilization of their pay and maybe look at increasing the pay. I know it's not great. They get roughly $100 for giving up a Saturday and doing an exam. We do have some on Friday. We have 2 today that are going on, but predominantly they're on Friday. So to have 28 in 1 month is pretty darn busy. And so I want to commend staff too. They all took a couple of exams and we've been able to cover most of them. I think we did decline 1 or 2 and they were lower classes that had less than 10 people. And we said, unfortunately, we cannot provide a record. June, so far, we have 15. You have to submit 30 days in advance and more could come in. But we're down to 15, still a little higher. We usually have around 10, I think it seems to be the average. That is the education items that we have right now.
Taking EMS director's report.
That one's fine. First of all, the non-rural policy was filed and that is effective. And so that was on April 10th. It is out there. We also do have a form to do that out-of-state verification. And so we do have a means of processing those now. And so we can proceed with that non-rural policy that the commission approved. District forums are going on. The first one is over and that was here at May, District 5 on May 2nd. Very successful, nearly 50 people. A lot of good information, a lot of good feedback. We took some of the feedback from that day and have tweaked a little bit of the future ones. But coming up at the end of the month, we'll be in LaPorte on May 30th. And then next month, we will be in Huntington. And then the next one will not be till July after the EMS Commission meeting. So I'll give an update there. We do stop morning our EMS updates. We do have a lunch provided by the EMS Association, thanks to them. And then we have afternoon is breakout sessions and then also the state regulations for providers that kind of cover the different regulations that impact the organizations and providers should know. Those are in Acatus. We encourage you to look for district forum and pre-register because that's how we can alert the EMS Association on how many people are eating to make sure there's sufficient food. Also helps with our planning, like Margot has been trying to go to do the EMSC, but if no one shows up, she may not travel to the farther one. So we need people to register so we know that who's doing that. When we did it 2 years ago, there were individual sessions in ACADAS. This has this one district forum session, but there are questions. Do you plan to attend this? Do you plan to attend that? A lot of people did select the breakouts, and then I think we are trying to look at the language. But I think they were like, that sounds interesting, that sounds interesting. It doesn't help us if you check every one. If you would check one of them that you plan to attend, then that will help. And those times that we do our local time, so if we are in a slower time zone, then we will be on their time.
Slower time zone? Indiana EMS 2025 vision for the future. Again, we came together, we have stakeholders, we want to try to create this report. The good news is we have had meetings and we frankly have gone over the main categories I have there: funding, workforce, EMS education and careers, safety, operations, and an essential function. We just met yesterday and we have our findings. We issued findings and then we have recommendations based on those findings. And so we do anticipate having a report sometime in June. And so that will certainly be on the EMS Commission agenda for July. And I will brief you because some of those have recommendations that IDHS and EMS Commission work to address certain things. So I think that will be a positive thing. Some of it may not surprise you, and then there are some really good ideas that are coming out of that. So very exciting work. We thank the stakeholders. Health First, which is our funding for EMS readiness. Again, we had the 500,000 for MIH, but we also have roughly 6.4 million this fiscal year and next. We did do the training institution equipment grants, 1.3 million. And it was due yesterday. I need to email them and see on the bids because that is in a bid process. I apologize. That's for the, I always see online. That is for the online test prep renewal is out to bid. The online education, we added bid and the only bidder, but we're pleased is School of EMS. And so we have contracted with them to do courses. And we, right now, this year, we're going to do 2 EMT courses and 1 medic course as a quasi virtual course. We call them virtual or online. Realistically, they have to have a host site in Indiana and they have to do skills in person there. We are still, there it is, sorry. The online classes would be, the medic class would be Central Indiana East, because we found kind of a desert there programs. And then the online EMT classes will be Northwest, kind of focusing on Newton, Jasper, Pulaski, and White counties. And then the South one would be Martin, Davies, Lawrence, and Orange counties. And so we look forward to updating on that and see what progress we have with those classes. Bowen Center, we are still going through contracting. I think we're finally, we went slow enough and then I chuckled. I had to, if you know my patients had to groan. It's been an ongoing thing with it. We finally were done almost. And then Bowen Center said, well, wait a minute, we agreed to start in April. We start in May, it's going to put us behind. So we had to redo everything so that we're starting in June. So we do have a contract ready. We are going to start in June, and then it will be for currently a 1-year contract renewal, get us a dashboard on workforce and some other further studies going on. The test prep package is the one that was due yesterday for a bid process, and I'll find out and I'll keep you posted. Our goal is to provide access to electronic test prep for every. And so that would be funded by the state. rapid. I know Dr. Gaze will probably give you an update. It's out to bid and we have shared that, so you can find that under the procurement. If you are interested in bidding on that, and it does cover the 2 regions, Region 1, Northwest, and Region 2, Southeast. And kind of the pocket of where it takes the longest to get to a trauma center. We were able to purchase a new simulation mannequin, a new HAL. I need to figure out, as we call the old one HAL, I haven't heard what we're calling the new one. But it is state of the art. I would say it's really cool. It sounds really cool. It's a nice box in our copy room. It came in and Tim opened it and started at the instruction. And it's like, warning, your contract requires assembly by a trained person or you void the warranty. So he quickly put everything back. He's like, Greg, I opened the package, but so it's scheduled coming up in a couple of weeks. They will put it together. They'll do training. But some of the cool things is active facial movements. For instance, it can simulate a stroke and have facial drooping and things of that nature. It can do skin progression through cyanosis, redness, pallor. It can simulate seizures. It can has programmable capillary refill if you want to measure those. So very interesting mannequin. We hope we have the training, the assembly and the training. And that we hope to roll it out by July 1st. Thought of a name. I think we need to call him Commander Data. I start. We also are getting a trailer for the new sim lab. Rather than go with the ambulance model, we had a bid and we have a contract. We hope to have it. The contract says by 9 months. We hope to have it less time. They have to have drawings to us. We have preliminary drawings, which look good, but they have to have the final drawings to us by June 1st. And in it, basically, it's a longer compartment. What we gain, the back will be built like an ambulance, so it'll still have that feel, but then has a walk around with an office section where a glass window where they can monitor and like Tim can set up his computer and run the simulation without actually having to be in the room with the actual EMS people. So I think and it also is better on storage, also prevents the current one, knock on wood, because we got to get by and breaks down. And when it does, then we have to manually haul equipment. Whereas this one, the main thing that's more likely to break down is the truck, which we're purchasing, but we have other trucks that we can use to pull the trailer. So I think this is going to be a huge improvement for us. We're very excited, so I wanted the commission to know about that. We did enter into a new contract with the Aketas, and part of that, we purchased additional upgrades. One of the modules is continuing education, and with continuing education, that will allow online tracking so people aren't as stuck carrying around their papers and risk losing them, which is kind of old school, but we still do it. I got a folder on my desk. I keep mine in because there's not a perfect way to currently track. This will give us more opportunity for people to track. It's going to take a little bit of time because we're trying to figure out, and if people have ideas, let me know or let our staff know and they'll get back. For instance, approvals. Are we going to allow anyone to log something? When do we verify it? Or does the organization verify it? And so if they're trying to count as continuing ed, we're looking at maybe an approval process, but we're still building it. So certainly more announcement. I think it'll probably take a little while to build. So I think that's going to be a 2025 full announcement of it. Sooner, hopefully, is the public search feature. Try to make it a little easier. We used to have an easy search. You could search for someone. You can do that with other professions. If you want to look up myself, Hillary, or Justin as the attorney, it's very easy. You can see our status. But on EMS, you have to know our PSID and our email to verify. And this new system would make it more user friendly, and you could go back to search parameters to try to find people. And so I think that both of those are kind of key initiatives. that we feel will improve the cadence. Instructor development, we're focusing for next time. I have been briefing on it, but I wanted to give an update. We were not able to complete it in this fiscal year. Too many big projects going on, so we will be doing instructor development courses in 2020, either later this year or early 2025 in the next fiscal year. Partner updates, EMS Compact is still proceeding, still chairperson. NASIMSO, we are planning our regional in-person meeting, and that will be hosted here in Indianapolis again out here in May. And that will be the week of Indiana Emergency Response Conference. So that first week of October. So I will share when we have more. You're welcome to come participate if you would like. We also have an annual meeting where all the states attend. That is coming up next week. And so I will be traveling, Dr. Yazel and Robin, to Pittsburgh, and we'll be there next week for the NASIMSO annual meeting. OSHA, everyone's favorite term, emergency response rulemaking. They are proposing to tighten regulations on EMS. We have fallen under kind of general provisions, and there were not specific provisions for EMS like some other areas, and they now are proposing emergency response. There is the link if you want to read it. Kind of high level, it would add leadership requirements that as you progress through leadership, you have to take further safety training. You'd have to have a fitness leader or officer that would provide exercise training, good eating habits, things like that. Establish a compliant medical program within the organization. Requirement of PASWAPR training for all responders. And then also facility requirements, such as smoke alarms, carbon dioxide detectors, exhaust exposure prevention, things like that. So it's complex. So we are not necessarily, our staff's going to review it because from the fire side, Marshall Jones has some concern. And we may consider whether we are making a comment on it, but I feel like organizations need to know it's out there and need to look. I know the AAA, American Ambulance Association, has I think a 20-page response they have to it. And so there are a lot of groups that are speaking. So I think it is meeting some resistance. I'm on the record, as I said, with the traffic thing, it's ironic that I pushed that. I talk about safety. I think this would be a little challenging to implement because I think it's going to have a lot of costs and it's going to be a challenge for a lot of services, particularly the volunteer service. And so I think people need to look at it because they are accepting comments through June 21st. And so you can make comments as an individual, your department can. If you're a group, the EMS Association or someone else, then they can certainly make a comment as a group on these requirements. This week is approaching May 19th to 25th. This year's theme is honoring our past, forging our future. And this will be the 50th anniversary of having an EMS week. And there's the proclamation. Gerald Ford had the privilege of the first one. And so we are, our public affairs section has been very busy. And you will see they asked for nominations. And so with the nominations out there, you will see a website and they're going to have kind of honorary posts about people that have contributed. So watch for that. They also will have they are sponsoring on May 22nd, a blood drive at the Indiana Government Center South. So if anyone's in the area and would like to donate blood, that would be welcome. The governor did just ink a declaration honoring EMS week as well. That will be put on our website coming up. I do not have a copy of it yet, but it was signed honoring that. So that's 50 years of EMS week. I know there were organizations that were kind of forming maybe a few years earlier than that. but I think it's a huge milestone. And we did hear from the State Trauma Care Commission at our meeting there. There was a motion from the trauma surgeons that was supported, and it was voted unanimously. The Indiana Trauma Care Commission stands in support of National EMS Week, celebrating the dedicated commitment of our emergency medical services professionals. We honor the remarkable men and women who provide critical medical care, swift response, and compassion to Hoosiers when they need it most. We expressed our deepest gratitude for their service and pledge our continued support for their vital work. And so we thank the Trauma Care Commission membership and also thank Dr. Beaver for characterizing that in a written form. And we are very thankful, and from our staff and our agency, we will reach out, but thank you for all you do for EMS Week. And certainly take it as a time to reflect on what you're doing, celebrate what we're doing, and as it notes, forge forward as well. That is all I have, unless you have questions. I know I had a lot of information. I can email the slides if they'll go out. I may have to do a PDF.
Thank you. Hearing none, we on to EMS State Medical Director's report, Dr. Eads.
Yeah, still have a few odds and ends. Number one, just wanted to double down on what Margot had to say. This survey, readiness survey, is a big lift for her and her team, and our team tries to help where we can, but really like to enlist everybody to get out there to your local services and encourage them. The closer it gets, the more of a manual process it becomes. So the more surveys we can get in earlier helps everybody. And just something I think is really important that, I'd like Indiana to be on the forefront, not right in the tail end of. And just to kind of dovetail it with some of the hand-heavy things that we're doing as a state, I think it's a great time to really be intentional on focusing on our pediatric readiness there. It's never been a better time. So MIH wise, just wanted to also mention they had a national MIH conference in Nashville in March after our last commission meeting. We probably had 15, maybe 20 services there. Indiana had an awesome we had an awesome representation, a lot of great presentations. Really came across strong as a state with that, and have a lot of other services that are interested in taking the plunge. And Emily does a great job of getting out there. So I do think we'll see some more applications coming in the future, which is exciting too. CARES, we've talked about that for a while. I think that's something I've brought up before. Having some productive meetings on becoming a CARES state. Look, I think some of the hurdles that have been in our way in the past, we've found some workarounds. So really looking forward to advancing that. And I think feel good about where we're at for the first time in a few months. So I think we're looking good. Just to frame a reference, that's a cardiac arrest registry. 36 of the 50 states are already active. So again, it's another one we've been wanting to do for a while. Don't want to be on the tail end of that process. So looking good there. Craig mentioned the interfacility transfer pilot, the rapid teams, that is out for bid. Had some great conversations already with some services that are interested. Encourage anybody that has questions to reach out on that, because it is kind of a complex bid, and I want to make sure that they're ultimately comfortable with what they're proposing and understand our goals as well. And find a solution that we're all comfortable with. So really encourage anybody who's interested to reach out and have that discussion. And already had some great talks on that, and look forward to some good bids there. Also, I think we'll use the data from that combined with some other things. There's going to be a big focus on interfacility transfers over the next few years. That's something that pretty regularly comes up in our trauma commission and some other things. Also, in my discussions out in the state. So I think, we'll use that information along with some other things, and hopefully really kind of put that under the microscope over the next couple of years. Another thing, and this is more probably for your visibility, I do have some concerns about OB services across the state. We've seen the hospitals stop with their OB deliveries over the last few years for financial reasons and other reasons. Also heard, and this hasn't been verified, but I've heard the two biggest residency programs in the state, none of the graduating residents stayed in Indiana to practice afterwards. As you can see, when we're already struggling from a workforce side of things, won't take too many years of that before we're really gonna be in a bad way. we're trying to be on the front end of that, looking for creative solutions. Already changed, I think 2 of our last 3 state in-services have been on OB or delivery related topics. Really, we had a great perinatal conference up in Indianapolis last month. So really looking at ramping up education and kind of trying to be on the front edge of what I think is going to become a big challenge for us. So, we talked about some public, the HFI funding. The individual health departments are doing their next year HFI budgets right now. They're due, I think, in the first week in June. And just kind of to give you a frame of reference for that, the first year was a lot of people's, this is our pie in the sky programs we've always wanted to do, but haven't had the funding. Second year, there's, I think, some more opportunity and some encouragement from the state level for community collaboration. So this is a great time to approach your local health departments, especially MIH programs, but even your local EMS thing, because there's a lot of trauma and injury prevention focus and things like that. So it's a really, really good time for some outreach. And even if you've done that before and not been able to get much traction, it really is a probably time well spent to make that connection again. Whole blood, we have 4 programs at least now doing that. Crawfordsville had a utilization recently. I think South Bend now is up and running, and they've used it twice. So encourage and look forward to when we get enough in numbers to bring it back to start sharing some outcomes with the commission and around the state and things. And hopefully seeing some of these other programs. I know we have some others that are, again, putting some information together to look to take that plunge.
Our current program still is focusing on trauma administration.
Yes and no. I think, that's the investment and as a stakeholder from the trauma surgeons is really important in order to get your supply. I think, postpartum hemorrhage and some GI bleeds and things, most of them still at least have that on the radar, if not part of their protocol. That's what I would encourage as well. But I think, the trauma side of it's been a big focus just from a grant side. And again, that tends to be one of the biggest, most important stewards of the blood products. So getting their investment is a big deal, so rightfully so. Last but not least, state in-service first Wednesday of every month. Always looking for presenters. So, I think they'd love to hear all the cool things that you guys are doing and your expertise. So please reach out to me. I also want to make it more case-based. So any good cases you guys get, please share with me so we can make it part of that. I also do an email each month that kind of gives you a heads up on when it's coming, and also afterwards a summary email. So please, any of your like trauma symposiums or EMS education events, share those with me because I'll get them out to that bigger distribution list as well. If you'd like to be on that email list, let me know. I want to get it out to as many people as possible, but don't want to spam you with emails if that's not your cup of tea as well. So, and last but not least, I'm down to just a handful of counties that I haven't been to yet. So if I haven't seen you, please reach out to me. I apologize to far northeast Indiana. That's the only general region I haven't been to. So they're high on my list. So the Angola and that area, I've gotten to Fort Wayne and then just had no moss, couldn't drive any farther. So, but I've talked to them and made some arrangements to get up there. So that's the last bigger region I haven't been to. And then other than that, it's just some counties here and there that I haven't, but looking good that way. And honestly, it's a great these initiatives and things I'm talking about are direct results of things that I've heard from boots on the ground when I'm getting out there. So really appreciate those invites.
Questions for Dr. Yates? Hearing none, chairman's report direction. I just have 2 things. I guess we kind of stole the first one there. I just want to also encourage everyone to support the pediatric readiness survey as quickly as possible. And please don't miss the opportunity to get your results back and go sit down and take a few minutes and go through and make some notes and some planning off of that as well. Secondarily, U.S. Consortium of Metropolitan Medical Directors, otherwise known as the Eagles, is coming up in June, Hollywood, Florida. Fairly cheap conference to attend as far as leaving the area for a conference, both with airfare, hotel rates, price of conference, everything is kept reasonable that, most field personnel can probably take advantage of that. So it's a really good opportunity to meet most of the movers and shakers and members of the National Association of EMS Physicians, as well as see the cutting edge data coming out of individual systems moving and progressing their systems forward. And they're very, very candid as to the successes and the failures. So it's a good group and a good thing to attend. You'll probably hear close to 70 different topics over 2 days. Because I think they're pretty much limited. Some things will go as long as 15 minutes, but most of the presentations are 5 to 10 minutes. With that, our next meeting is here in May, 1610 Reeves Road, July 12th at 10 a.m. And I will take a motion to adjourn.